Assalamualaikum. Good evening. I'm Yuslina Yusof from Group A with my team Nozahani Sharmila binti Jafar and Nur Hafaziran binti Hamzah. Today, we would like to present the topic Community Nutrition Maternal. So, for the healthy food to eat during pregnancy, according to the World Health Organization 2000, nutrition is a fundamental pillar of human life, health and development across the entire lifespan. This means the World Health Organization goals is everybody reach and maintain the highest attainable level of the health. It began from the earliest stage of fetal development at birth through infancy, childhood, adolescence, and on into adulthood and old age. Proper food and good nutrition are essential for survival, physical growth, mental development, performance, and productivity, health and well-being. It means human nutrition is concerned with the access and utilization of food and nutrient for life, health, growth, development, and well-being. Further ado, in my presentation, I focus on healthy food to eat during pregnancy. Nutrition in maternal is very important. For example, here, uh, from the pamphlet from Origin Health and Science University, we see pregnant women need to eat variety of food for health to weight gain during pregnancy. Here is the sample, the example for the fulfill the food requirement for the pregnancy woman, such as protein. Protein is choose so, sources such as bean, nuts, and so on. And then for the pregnant woman also encouraged to take the milks. And then, as we know, carbohydrate is important for the energy. The carbohydrate of in here, such as bread, rice, pasta, or oats. And then for the high fiber diet here, from the pamphlet, we see the picture about non-starchable vegetable and fruit. This is important because for the first trimester, mother prone to get constipation. So we encourage mother to take more vegetable and fruits. We have a lot of categories of nutrients, but my team selects 8 categories of nutrient, the important one, the such as energy and calorie, fats or DHA, protein, carbohydrate, calcium, vitamin D, iron, and folic acid or folates. We go to one by one for the energy. Energy or calorie. A woman's need 15% increasement of calories during pregnancy. Eating for two. It means for mother and fetus. It means eating an additional 300 calories per day, such as 3 cups of non-fat milk or an English muffin with 1 tablespoon butter and a small banana. This is from American Academy of Physician Assistant, AAPA. The second one is a protein. Protein is very important because protein is to maintain maternal tissue and fetal growth. Protein also making antibody for their immune system. Excessively high protein diet can affect fetal development, but with the low intake of protein diet can affect of weight and length of birth. International guideline for recommendation in protein intake is increase protein intake during pregnancy for maternal tissue and placenta, especially in the second and third semester. And for example, the protein is meat, eggs, or from plant source like bean and soy products. So I pass my presentation to my colleague Shamila.
Thank you, Yusina. I will proceed. So the third one is carbohydrate. Carbohydrate are the main source of the energy to the body and is to be considered as the major part of one's of total daily intake. There are two types of carbohydrate, which is simple carbohydrate and complex carbohydrates. So carbohydrates for children and adults need a minimum of 130 grams of carbohydrates per day. Pregnant women require an additional 45 grams of carbohydrates per day. This one is from Institute of Medicine Dietary Reference Intake reported 2009. Sugar are the simplest form of the carbohydrates and can add sweetness to a nutritious diet. Example is fruits, vegetables, grain, and several dairy products. Carbohydrates also bring a variety of other important nutrients to the diet, such as vitamins, minerals, antioxidants, and fiber. We go next to fat. Fats provide energy and transport nutrients. There are two families of fatty acids that are vital for body function, such as omega-3 and omega-6 fatty acids. Fat is the key for good nutrition, health, and storage of many important vitamins. Most important essential fatty acids are critical for baby growth and development. 20 to 35% of fat from total calories intake. Sources for unsaturated fat is fish, vegetables oil such as canola, soybean, olive, and flaxseed. After delivery, breast milk fat content is mainly dependent on the food period, the stage of the feed, and the number of pregnancy, while maternal diet and lifestyle are less relevant. We go next to DHA. DHA is docosahexaenic acid. This is a major polyunsaturated fatty acid contained the human brain and retinal rods. DHA is an omega-3 fatty acid that is good for baby's brain and eye development. DHA for pregnant women should get an average dietary intake of 200 milligram DHA per day. DHA we can find it in oily fish such as salmon. Next, we go to calcium and vitamin D. For calcium, 99% abundant mineral in the human body located in the skeleton and in the teeth. So calcium is needed for the growth of strong bones and teeth. Importantly, in pregnant women younger than 25 years old, which is bone are still growing. So the recommended vitamin D for pregnant woman is 100 milligram per day, or calcium supplement of 600 calcium per day for non-consumer dairy product. The main sources of calcium, which is milk, yogurt, cheese, dark green leafy vegetable. So vitamin D is important for the absorption and use of calcium. 5 micrograms of vitamin D are recommended per day. So the next is iron. Next. Iron play essential roles, carries oxygen through the blood and deliver it throughout the body. Iron aids in immunity, brain development, body temperature regulation, metabolism, and physical performance. 90% per day is conserved and reused in the human body. International recommendation: iron intake for pregnant women should consume 27 milligram per day due to an increased amount of blood in their bodies. Example for iron is fish and poultry, enriched in whole grain breads and cereal, green leafy vegetable, beans and nuts, eggs and dry fruits. It is from AAPA 2009. Next, the important message for pregnant women is iron absorption from eggs and plant food can be increased when eaten with food high in vitamin C, such as orange juice or red bell peppers. Absorb best when taken between meals with water or juice and not with other supplements. Substances in coffee, tea, and meat can inhibit iron absorption. Taking iron supplement at bedtime may help reduce upset stomach and heartburn. So next, we will proceed to Hafazeran.
Okay, thank you, Nurjani Shamila. Next, we proceed to folic acid and folate. So folic acid and folate is a category of a vitamin, also vitamin B, that should be taken before and during early pregnancy. This is because any woman of childbearing age planning or capable of becoming pregnant should consume 400 microgram per day. It is to reduce the risk of spina bifida and other neural tube defect or birth defect of the brain and spinal cord in infants. The folate is the term of nutrient found in naturally foods, and the folic acid is the synthetic form used in supplement, and it is fortified grain products. Leafy dark green vegetables, legumes such as peanuts, citrus fruits and juices are examples of folate. So the additional intake for the pregnancies. So one of the additional nutrition for pregnancy is fibers. The daily recommended intakes of fiber is 25 to 35 gram for pregnancy. It is to modulate gut microbiomes. It's to prevent asthma by epigenetic switch and by impacting the gut microbiota. The excess of fiber is not recommended. It is because it will causes nutrient loss and diarrhea. For example of fiber is fruits such as apples, raspberry, and pears, whereas the vegetable is broccoli, peas, and artichokes. Whole grains such as brown rice, cooked barley, and legumes such as black beans, chickpeas, and lentils. So the another is water. In pregnant women, the advisable of water intake is to add 300 ml per day of water. It is to adequate intake equals to adequate intakes of 2.3 liters per day recommended to non-pregnant women. Breastfeeding women are recommended to increase total water intake by 800 ml per day during the first 6 months postpartum and by 650 ml per day after 6 months of postpartum. It is to decrease constipation, hemorrhoids, also increase the energy and decrease the risk of urinary tract infection, and also in preterm labor and reduce the risk of preterm labor and preterm birth. Next is caffeine. Some people say caffeine is not suitable for pregnancy, but caffeine is found caffeine is found in coffee, tea, some soft drinks such as also chocolates, and some over-the-counter medication. The moderate caffeine intake is considered to be about 300 milligram per day are safe for both pregnancy women and breastfeeding women. Over 300 milligram per day of caffeine could make it hard for the baby to fall asleep and or lead to trouble feeding the baby. Limiting caffeine intake to no more than 300 milligram per day is recommended for breastfeeding mother. So this is the recommended gestational weight gain guidelines by the Institute of Medicine 2019. And the mother should follow this recommendation to prevent from underweight and obese in pregnancy. So the food that should be avoided for the mothers to uh, give safety for the baby and also to the mother. So the mother should avoid from raw seafood. It has to be cooked above the fish should be cooked to 145 degrees Fahrenheit, and also to avoid unpastured juice such as cider and milk. The milk should be pastured version can be taken. The next is soft cheese and cheese made from unpastured milk. So the mother should take hard cheese and cheese made with pastured milk. And the another is to avoid is undercooked egg. The egg is one of nutrient um, nutrient intake for the mother and importance because it contain energy. But the mother should take the egg with the firm yolk, means it's fully cooked. And promote daily salad, example egg pasta and chicken. And this food should be made from these dishes at home. Avoid also raw sprout and it must cook thoroughly. Also avoid cold hot dog and luncheon meat and undercooked meat and poultry. All of this is to prevent from Listeria and Toxoplasma gondii in pregnancy. It is because 50% of toxoplasmosis infection in users are acquired from the food. So the mother should have clean hand before handling the food, well cook of food, and chill the food or the leftover and put it in the fridge within the 2 hours of being cooked. The most important is the mother should be avoid and should be avoid of alcohol and smoking intake. So the smoking during pregnancy can cause the baby to be born too small or too early. It is more likely to have a baby with a birth defect or the mouth and lip called an orofacial cleft. The baby who breathes in other tobacco smoke can be more likely to have ear infections, lung infections such as bronchitis and pneumonia. And if they have asthma, the breathing in other people's tobacco smoke can trigger the asthma attacks. And this baby are also more likely to die from the sudden infant death syndrome. So this is our reference. That's all. Thank you.
Thank you.